Hey, hi everybody. So today I wanted to talk in our oncology or cancer treatment. There are so many new things which people are hearing, particularly in the treatment. I just wanted to clear some confusion because many people ask these questions like, what is this immunotherapy? What is this cancer chemotherapy? What is radiotherapy? So many things they get confused, and essentially they are all they think. First of all, they are scared of the word cancer, but everybody thinks immunotherapy, radiotherapy, everything leads to loss of hair, vomiting, unable to tolerate. But it is not true. So today in 2025, it is not like one shirt fits for all. It is tailor made. You have to be very specific on what we are diagnosing, because the diagnostics have improved so much, whether it could be imaging, MRI, PET scan, or whether it could be pathology or molecular testing, immunology testing, or genetic testing. So we need to be very, very specific on what we are treating. So essentially, example, recently we had a patient who was not responding to any sorts of chemotherapy. But upon testing us a test called as PDL1, that is an immunotherapy marker. So he just had to give this drug, immunotherapy drug, and he the disease melted away like anything. What I mean to say is, today, even in sarcomas, where people are, we had not seen any much of an improvement over the last many decades. That means I would say at least 4 decades. Now, with advent of immunotherapy and targeted therapy, there is so much of improvement. Another example, I wanted to give a simile. Essentially, this is like, now it is like a sniper. These drugs are like a sniper. What I say is, earlier, if you had to kill some bad people or terrorists, you just go and bomb an area, and with the terrorists, the civilians also die, the terrorists also die. That was chemotherapy. But now, with targeted agents, essentially, you creating a face ID or you marking them through some means, and you give a pair of special glasses to identify. So you, through a sniper, we just hit those bad cells only. Sometimes they are just given as tablets without almost like zero side effects, and sometimes in injections. But way, way, way different than chemotherapy. And is it needed, or is it something like very fancy, new type of treatment which somebody is pushing you? No, it is very much needed today, because if your loved ones need a perfect care, better to work them up properly with the help of immunology testing, genetic testing. Like, we have set up a profile to our immunogenomic profiling of sarcomas. So once we do that, we'll understand a complete picture of what the disease behaves like, along with the imaging, whether it needs surgery upfront, or chemotherapy, or immunotherapy. Like denosumab. Denosumab is a wonder drug. It is like super targeted drugs. Whichever patient has this targeted marker positive, most of like 99% of my patients we have treated more than 500 plus giant cell tumors with this drug, and hardly any side effects. Likewise, this example, what I was telling you, look at the PET scan before the treatment treating with the PDL1 immunotherapy agent, and look at it after the treatment of a immunotherapy drug. So what I mean to say is, immunotherapy has got a beautiful role coming to the future, and how you boost your immune system, how you boost our immunity to activate against these bad cells, is what is immunotherapy. So for sure, this is a must workup nowadays. Absolutely no questions asked. Thank you.